She walked into Harbor Ridge Medical Center at 6:47 in the morning carrying a travel mug of cold coffee and a bag with a torn strap. And within 4 hours, the chief physician would stand in front of witnesses and tell her she was a liability. The emergency room had seen difficult shifts before. It had never seen anything like Emily Carter. They thought she was ordinary. They were wrong about almost everything: her background, her training, her patience, and most of all, her limits. When the soldier arrived with his chest torn open and 3 different people arguing over the wrong protocol, Emily was the only one in that room who knew exactly what was happening, and they still told her to step back. If you're just finding this story, hit follow right now, because what happens next is something you will not want to miss halfway through. Like this video, drop a comment telling me what city or country you're watching from. I want to see how far this story travels. Now let's go. The morning started badly before it got worse. Emily Carter had worked the overnight into day shift twice this week, covering for Marcus, who had a sick kid at home, and for Daniela, who had called out with something that may or may not have been real. She didn't complain about it. Complaining required energy she'd learned years ago to redirect toward more useful things. She clocked in at 6:48, dropped her bag in her locker, pulled her dark hair back with a rubber band she found in her jacket pocket, and walked onto the floor before the outgoing night nurse had even started her handoff notes. The ER at Harbor Ridge was not a glamorous department. It sat on the south end of a mid-sized medical center in Phoenix, Arizona, the kind of city where the heat hit you like a wall the moment you stepped outside, and the emergency room reflected that: constant, relentless, and usually 2 patients over capacity. The department had 18 bays, a trauma unit with 2 functioning suites at any given time, a staff that rotated fast enough that new faces were common, and a culture that had calcified around a specific hierarchy. Nurses did their jobs. Doctors made decisions. Anyone who confused the two heard about it quickly. Emily had been at Harbor Ridge for 11 months, long enough to know the rhythms of the floor, the names of the janitors, and the overnight security guard named Tomas, who always kept a box of crackers at the front desk, and which of the attending physicians were actually competent versus which ones had learned to perform competence well enough to avoid scrutiny. She had also been there long enough to know that Dr. Raymond Holt, chief of emergency medicine, did not like her. She had never asked him why. She suspected it was because she asked too many questions. Not insubordinate ones, not yet, but precise, pointed questions that sometimes made him pause. And Raymond Holt was not a man who enjoyed pausing. He was 53, broad-shouldered, with gray at his temples, and a way of walking through the department that made interns press themselves against the walls. His reputation had been built over 2 decades of aggressive, confident medicine, and his confidence had never been meaningfully challenged. Until recently. The first time Emily had flagged a concern, a potassium dosage on a cardiac patient that she thought was being pushed too fast given the patient's kidney function. Holt had looked at her with a particular kind of blankness. Not the blankness of someone who hadn't heard her. The blankness of someone deciding whether she was worth addressing. "I'll take it under advisement," he'd said. He had not changed the order. The patient had developed a minor arrhythmia 4 hours later that required intervention. Holt had not mentioned Emily's flag. No one had. The second time, she'd caught a medication reconciliation error on an elderly woman who'd come in through triage, a duplicate blood thinner that could have caused serious bleeding. She had corrected it before bringing it to the nurse supervisor, Brenda Marsh, who had looked at the chart with tired eyes and said, "Good catch," in a tone that suggested it wasn't that good and that Emily should not expect applause. By the third incident, a chest x-ray that Emily had looked at on her own time while the attending was occupied, which showed a subtle opacity she thought warranted a second look. The response had not been gratitude. Dr. Holt had found her in the supply corridor afterward and had spoken quietly, which was somehow worse than if he'd shouted. "Miss Carter," he'd said, "I don't know what you were trained to do before you got here, or what you think your role is, but I need you to understand something. You are a floor nurse. A good one, from what I've been told, but a nurse. You document, you administer, you report to your supervisor. You do not independently evaluate imaging or second-guess treatment plans. That is not your lane." She had held his gaze. The patient had early consolidation in the right lower lobe. The attending missed it. It was pneumonia. The patient was treated and discharged appropriately. After a 6-hour delay, Holt had been quiet for a moment. "If you have concerns about patient care, you go through proper channels. You don't freelance. Are we clear?" "Yes, sir." He had walked away. She had stood in the corridor for about 5 seconds, then gone back to her patients. That had been 3 weeks ago. Since then, the atmosphere around her had shifted in that specific institutional way she recognized. Not open hostility, but a withdrawal of warmth. Colleagues who had been friendly became neutral. Brenda Marsh had started auditing her documentation more frequently. The charge nurse, a heavy-set man named Victor Gaines, who had been at Harbor Ridge for 11 years and understood the political ecosystem better than anyone, had pulled her aside one afternoon and said, in a genuinely kind voice, "Emily, I'm going to give you some advice because I like you. Keep your head down. Holt has a long memory." She had thanked him. She had not promised anything. The shift on the morning of September 14th began with a sprained ankle, a child with an ear infection, and a man in his 60s who was certain he was having a heart attack and was actually having a very severe case of heartburn. Emily moved through all three with the quiet efficiency that had become her defining characteristic on the floor. Fast, accurate, minimal wasted motion. She started an IV on the cardiac scare patient so smoothly that he looked at his arm afterward like he was trying to find where it had happened. By 9 o'clock, the ER had 10 patients. By 10:30, 15. The waiting room had that particular sound that came in waves, crying children, the low murmur of anxious family members, the occasional sharp voice that rose above the rest before being managed by triage. Emily was doing a wound assessment on a teenager who had put his fist through a glass door. Not as dramatic as it sounded. He'd done it because he'd been startled by his own cat, which she did not point out because he was already embarrassed. When she heard the radio crackle at the nurse's station, she couldn't make out the words. But the tone was different. There was a texture to emergency radio traffic that you either learned to read or you didn't. She'd learned it a long time ago, in a different context, and her attention shifted before she consciously decided to shift it. She finished taping the teenager's hand, gave him clear discharge instructions, and walked back to the station. Victor was standing at the radio, frowning. "What's coming?" she asked. "Military transfer, trauma, ground unit. They're about 8 minutes out. They bypassed Mercy General." He looked up. "Something about requesting specific clearance. I don't know what that means." "Means someone made a call above the facility level," Emily said. Victor looked at her. "How do you know that?" "Just makes sense. If they bypassed the level 1 facility, someone decided Harbor Ridge had something Mercy General didn't." She didn't elaborate on how she knew the difference. The next 8 minutes were preparation. Harbor Ridge's Trauma Bay 1 was cleared. The on-call trauma surgeon, Dr. Sandra Voss, was paged from her office. 2 more nurses were pulled to the trauma floor. Dr. Holt materialized from somewhere, as he always did when something significant was incoming. Not because he was needed, specifically, but because being present at significant events was part of how he maintained his position. Emily was assigned to trauma support. She positioned herself near the secondary bay, checked the crash cart, confirmed the blood products were staged, and the correct type and screen was on standby. Then the doors opened. Oh. He came in on a stretcher, and the first thing Emily saw was the way the 2 men escorting him moved. Not EMTs, not civilian paramedics. They wore civilian clothes, but their movement was wrong for civilians. Too controlled, too purposeful, scanning the room with a specific quality of attention. Military. Not army. The posture was different. The build of the man on the stretcher, even through the trauma dressings and the gray pallor of blood loss, was unmistakable if you knew what you were looking at. The primary paramedic giving report to Dr. Voss was rattling off vitals. Male, approximately 34, GSW right lateral chest, through and through, exit wound confirmed, pneumothorax suspected, 2 large bore IVs en route. BP was 88/60 on contact, dropped to 82/58 in transit, heart rate 118, oxygen sat 91 on 15L non-rebreather. Emily moved to the left side of the stretcher as they transferred him to the bay. She took his arm to help with the transition, and her hand found the dressing over his right chest automatically, not because she was told to, but because her hands had done this before, and muscle memory was not something you unlearned. She felt the quality of the dressing, the seal, the slight asymmetry of his chest expansion. Her eyes moved to his neck. Tracheal deviation, subtle, early, but there. She looked at his face. He was conscious, barely. His eyes moved to her. There was something in his expression, not fear exactly, more like a man making calculations, deciding who in this room was worth paying attention to. He's got a tension developing, Emily said. Dr. Voss was already at the head of the bed. Let's get him on the monitor first. The trachea is deviating left. It's subtle, but it's there. Emily kept her voice flat, not urgent, not alarmed. Calm the way she'd been trained to be calm, which was different from the calm that came from inexperience. If we wait for the monitor, we lose time. Nurse! This from Holt, who had positioned himself at the edge of the bay. His voice had a specific quality. Controlled. A warning inside a professional tone. Let the trauma team do their assessment. I'm not interfering with the assessment. I'm reporting an observation. She met Voss's eyes directly. Right lateral tension pneumothorax. The GSW entered through the right chest. The exit wound was confirmed through and through. If there's pleural air accumulating, I need a chest x-ray, Voss said. We don't have time for Nurse Carter. Holt stepped closer. Not loud. Not yet. I'm going to ask you one more time to step back and let the team work. The monitor came online. The patient's oxygen saturation was 89 now. Heart rate 124. Blood pressure 79/55. The patient's hand moved, the one on Emily's side. It was a small movement, weak but deliberate. He reached toward her arm, not grabbing, just touching. His eyes found hers again, and something in that look was communication, even if it wasn't words. She looked at Voss. Dr. Voss? Right lateral tension, second intercostal space. I'm telling you it's there. Sandra Voss was a good surgeon. Emily had watched her work before and had formed that opinion, which she didn't hand out freely. Voss looked at the monitor, looked at the patient, looked at Emily. Get me a 14-gauge needle, Voss said. Dr. Voss? Holt began. Get me the needle. Voss's voice was sharp. Second intercostal, mid-clavicular line, right side. Emily was already moving to the supply cart. She had the needle in Voss's hand in under 10 seconds. The needle decompression took 4 seconds to perform. The rush of air that escaped was audible in the bay. Emily was watching the monitor. The saturation climbed. 89, 91, 93, 94. Heart rate began dropping. 124. 188. 112. The patient let out a long, controlled breath. His color changed. Not a dramatic change, not the movie-style transformation, but the gray quality around his mouth shifted, just slightly. He was still in serious condition, but he was no longer in the particular crisis that had been building. The room was quiet for a moment. Get me a chest tube setup, Voss said. Her voice was steady. And I need blood hanging now. The team moved. Emily moved with them, slotting back into the support role she'd been assigned because there was still a lot of work to do, and the patient still needed everything they had. She did not look at Raymond Holt. She knew he was looking at her son. The chest tube went in 40 minutes later, after the patient had been stabilized enough for the procedure. Dr. Voss worked efficiently and without drama, which Emily respected. The two men in civilian clothes, the ones who'd come in with the patient, had positioned themselves outside the bay's glass partition. They had not left. They had not been asked to leave, which was interesting in itself, because Harbor Ridge's protocols were clear about non-medical personnel in the trauma area. Someone had made an exception. Someone above Holt's level, possibly. The patient, she still didn't have a name, the documentation had come in under a placeholder designation she hadn't seen before, was moved to a monitored bed in the critical care section of the ER while the trauma team coordinated the ICU transfer. Emily was finishing her documentation at the nurse's station when Victor appeared beside her. Holt wants to see you, he said quietly. I assumed. Emily, he paused. That was what you caught in there. The patient's stable, she said. That's what matters. He didn't say anything else. She saved her documentation and went to find Holt. I was in the small conference room off the main corridor, the one used for attending briefings and uncomfortable conversations. The door was open. He was standing at the window with his back to the door, which she recognized as a deliberate posture, the kind of thing people did when they wanted to communicate that they'd been waiting and that they were displeased but in control of it. She knocked on the open door anyway. Close it, he said. She did. He turned around. His expression was composed, which somehow made it worse than if it had been openly angry. I need you to explain what happened in that bay. I observed clinical signs of a developing tension pneumothorax and reported my observation to the treating physician, Emily said. Dr. Voss made the clinical decision to proceed with needle decompression. The patient's oxygen saturation and hemodynamic status improved following the intervention. You contradicted me in front of the trauma team. I reported a clinical observation to Dr. Voss. That's within my scope of practice. You escalated a situation in a way that was inappropriate for your role. She looked at him steadily. With respect, Dr. Holt, the patient's saturation was at 89 and dropping when I raised the concern. By the time the decompression was done, it was 94 and climbing. The tracheal deviation was real. The tension was real. That is not the point. What is the point? He let the silence sit for a moment. Not because he was uncertain. She could see he wasn't uncertain about any of this, but because he was deciding how direct to be. The point, he said, is that this department cannot function if nurses are overriding physician judgment in active resuscitations. I don't care how good your instincts are. I don't care how many things you've gotten right. The moment you start acting outside your defined role, you create chaos. You undermine the chain of command. You put every other patient at risk because you're creating a culture where anyone can second-guess anyone else, and that is how people die. He paused. Do you understand me? I understand that's what you believe, she said. He studied her. I'm going to be recommending to Dr. Patel and to hospital administration that your performance be formally reviewed. That's your right. I want you to think very carefully about whether you want to continue working here, Miss Carter, because what I saw today was not a nurse who understands her place in this organization. What I saw was someone who doesn't know how to operate within a system. She held his gaze for a long moment. There were things she could have said. Several things, actually. Not emotional things, not arguments, but facts she was holding behind her teeth that would have changed the texture of this conversation entirely. She had been holding them for 11 months, more or less, carrying them the way you carried weight you'd gotten used to without noticing how much you were carrying. She didn't say them. Is there anything else? She asked. He looked briefly surprised by the question, which told her he'd expected either more resistance or more submission. She'd given him neither. That will be all, he said. She nodded and walked out. The two men in civilian clothes were still in the hallway when she came back to the floor. One of them, older, somewhere around 45, with close-cropped silver-brown hair and a quality of stillness that she recognized from a specific context, was watching the door to the patient's monitored bay. He turned when she walked past. You're the one who called the tension, he said. It wasn't a question. I'm part of the trauma support team, she said, not stopping. That's not what I asked. She stopped, turned, looked at him more carefully, now that she was giving herself permission to. The way he carried his shoulders, the slight tan line that stopped at the collar, suggesting time in the field. The economy of his movements, the way he was evaluating her, which was not the casual curiosity of someone making conversation. Yes, she said. I called it. He nodded slowly, and there was something in that nod she couldn't entirely interpret. Acknowledgement, maybe. Or recognition. Like someone putting together pieces of something they'd been working on for a while. What's your name? He asked. Emily Carter. I'm a nurse here. I know you're a nurse here. He said it without condescension, which was notable given the last hour. That's not what I meant. She held his gaze for a moment. There was something very careful building in the space between them, something she wasn't going to acknowledge in this hallway, in this department, with Raymond Holt probably watching from somewhere. I should get back to my patients, she said. He didn't stop her. But as she walked away, she heard him speak to the other man in a tone too low for her to make out the words. She did not look back. The rest of the afternoon moved the way difficult shifts did, too fast in the wrong places and too slow in others. She had 4 other patients to manage, documentation to complete, and the particular weight of knowing that somewhere in the administrative corridors, her name was being attached to words like formal review and performance concerns, and whatever language Holt had chosen to frame it in. She checked on the military patient twice through the observation window. He was sedated, chest tube in place, blood pressure stable, oxygen saturation holding in the mid-90s. Whatever had brought him to Harbor Ridge instead of Mercy General, Whatever operation had left him with a bullet through his lateral chest and two intelligence officers, because that's what she was now reasonably certain they were, planted in the hallway, none of that was her concern. Her concern was that his chest was expanding symmetrically and his tube was draining and he was alive. He was alive. Victor found her near the end of her shift, leaning against the supply cart doing a final equipment check. He stood beside her and was quiet for a moment before speaking. "Patel's office called," he said, his voice low. "They want you in tomorrow morning before your shift, 8 o'clock. She absorbed this. "Okay. Emily," he hesitated. "Is there something I should know? About you?" She looked at him. Victor Gaines was a decent man. He'd been decent to her consistently, even when it would have been easier not to be. He deserved honesty, or at least a version of it. "No," she said. "There's nothing you need to know." He nodded, unconvinced, and walked away. She finished her check, clocked out, and was walking toward the exit when the overhead page crackled. Code blue, ICU 3. Code blue, ICU 3. She stopped walking. ICU 3 was where the military patient had been transferred 45 minutes ago. She stood in the corridor for 2 seconds. She could keep walking. Her shift was over. The ICU had its own staff, its own protocols, its own physicians. She had already done what she could do. She had already done more than they'd wanted her to do. She turned around and walked fast toward the ICU. The double doors ahead of her burst open from the other side, and a nurse she recognized, young, second year, named Priya, nearly ran into her. "He's coding," Priya said, breathing fast. "The SEAL. He went into VTOC or FIB?" Priya blinked at the question. "VFib. Dr. Ochoa is—" "Go," Emily said, and pushed through the doors. The room had that specific sound and motion she knew from a long time ago. Controlled chaos, the bark of the crash cart rolling, the rhythmic counting of compressions. Dr. Ochoa, the ICU attending on call, was at the head of the bed directing the team. The monitor showed the jagged, disorganized line of ventricular fibrillation. Emily moved to the left side of the bed. "Charging? 200 joules," someone called. "Clear," Ochoa said. The shock delivered. The monitor showed a moment of flatline, then a rhythm, not quite right, broad complex, slow. The room held its breath. Emily looked at the chest tube drainage canister. She looked at the output. She looked at the color. "He's reaccumulating," she said. The words came out quiet but clean. "The tube is clotted. He's tamponating." Ochoa looked at her. In this room, at this moment, there was no hierarchy in his expression, just a physician looking at someone who'd said something and deciding whether they were right. He moved to the drainage system. Looked. She was right. What happened next was not smooth. It was not clean or controlled in the way that medical dramas made things look. It was fast and loud, and involved Ochoa calling for a pericardiocentesis tray while simultaneously yelling for the cardiothoracic surgeon on call, and someone dropping an instrument, and Emily holding the patient's left arm still while his blood pressure bottomed out and climbed again and bottomed out again. 22 minutes later, the patient had a rhythm, a real one. He was alive. Emily stood at the edge of the room, her gloves bloody, her hands steady, and became aware of a presence behind her. She turned. The man with the silver-brown hair was standing in the doorway of the ICU. Behind him, 2 other people. Different from the ones she'd seen earlier, these ones clearly military, no pretense of civilian dress now. And behind them, partially visible, a man in uniform she recognized by rank designation without needing to think about it. The man with the silver-brown hair looked at her across the length of the room. His expression had changed. It was still controlled, still careful, but something in it had shifted. A calibration, a recognition of something he'd been uncertain about and was now not uncertain about at all. She pulled off her gloves, dropped them in the bin, started to move toward the sink. Her phone buzzed in her pocket. A text from an internal Harbor Ridge number she didn't recognize. "Dr. Patel has moved your meeting to tonight. Administration conference room, 7 p.m. Your presence is required." She stared at the message. It was 5:42 p.m. She put the phone away, washed her hands. And when she turned back around, the man with the silver-brown hair was still watching her, and whatever question he'd been working on since the moment he'd seen her in that trauma bay, she had the distinct and unsettling sense that he'd just found the answer. The administration conference room was on the fourth floor, away from everything that mattered, which Emily had always thought was probably intentional. It had a long table, 8 chairs, recessed lighting that made everyone look slightly unwell, and a wall of windows overlooking the hospital's east parking structure. Not a view anyone had chosen for the scenery. She arrived at 6:58 p.m. She had not gone home to change. She was still in her scrubs, which had a small blood smear near the left cuff from the ICU code, and she had decided not to care about that. Dr. Anita Patel was already there. The hospital's chief medical officer was a compact woman in her late 50s with precise posture and the practice-neutral expression of someone who had spent decades mediating between people who were wrong and other people who were also wrong. Beside her sat Brenda Marsh, Emily's nurse supervisor, who was holding a folder and not making eye contact. At the far end of the table, Raymond Holt sat with his hands folded, looking at the middle distance with the expression of a man who had already decided how this meeting would end. There was a fourth person Emily didn't recognize. A woman, maybe 40, in a dark blazer with a legal pad and a pen, seated slightly apart from the others, HR or legal, possibly both. Emily sat down without being invited to. "Thank you for coming," Patel said. "I didn't have a lot of options," Emily said. Patel's expression didn't change. "I want to be direct with you, Emily. We're here because there have been significant concerns raised about your conduct during 2 separate patient events today. Dr. Holt has documented both incidents and we've reviewed the records." "Okay," Emily said. "In both cases, you intervened in clinical decisions outside your defined scope of practice. In the trauma bay, you directed the treating physician toward a specific intervention. I reported an observation. Dr. Voss made the call. You contradicted the chief of emergency medicine in front of the team. He was wrong." Holt's jaw tightened. "Miss Carter, he was wrong, and the patient's oxygen saturation at the time of the intervention was 89% and dropping. It's in the record. It went to 94 after the decompression. That's also in the record." She looked at Patel. "I understand there's a conversation to be had about how I communicated in that bay. I'm willing to have that conversation. What I'm not willing to do is sit here and agree that flagging a tension pneumothorax was inappropriate." "You also inserted yourself into an ICU resuscitation after your shift had ended," Brenda said, finally looking up. "Yes." "Why?" Emily considered this, not because she didn't know the answer, but because she was deciding how much of the answer to give. "Because I heard the code call, and I had information that was relevant. The chest tube was clotted. The patient was reaccumulating blood in the pericardial space. Dr. Ochoa verified it and acted on it." "You could have relayed that information to the ICU staff," Patel said. "I could have. It would have taken longer. He was in V-fib." Silence. Holt spoke. "What I'm hearing is that you believe your individual judgment should supersede hospital protocol whenever you decide the situation warrants it. What I believe," Emily said carefully, "is that the protocols exist to produce good patient outcomes. When following the protocol produces a worse patient outcome, the protocol isn't doing its job." She paused. "The patient in ICU 3 is alive right now. That's the outcome." "That's not the point." "Then I'm struggling to understand what the point is." The woman with the legal pad wrote something. Nobody looked at her. Patel laced her fingers together on the table. "Emily, we value what you do here. Your clinical skills are not in question. What is in question is your ability to function as part of this department's structure. Dr. Holt has serious concerns. Several attending physicians have raised similar issues over the past few months. What we're asking ourselves is whether Harbor Ridge is the right fit for you." Emily had known this was coming. She had known it since the corridor conversation 3 weeks ago, maybe before that. The knowing hadn't made the words land any differently. "Are you terminating my employment?" she asked. Patel glanced at Holt. A small glance, fast, but Emily caught it. "We're placing you on administrative leave, effective immediately, while we conduct a formal review. Your access to patient care areas will be suspended pending the outcome." Emily sat with that for a moment. Administrative leave. Not fired. Not yet, but the difference was mostly procedural at this point. She knew how these reviews tended to go when the person initiating them was the same person documenting the incidents. She nodded once. "I'll need to collect my personal items from my locker." "Of course," Patel said. "Brenda will accompany you." Of course she will, Emily thought. She stood. She was almost at the door when Holt spoke again, and his voice had a different quality now. Not the controlled authority of the conference room, but something more personal beneath it, something that had been waiting for the right moment. Miss Carter, whatever you think you know, whatever experience you think you have, this is a hospital, not a battlefield. The sooner you understand the difference, the better off you'll be. She stopped. She didn't turn around right away. She stood at the door for one long breath, and in that breath she made a decision she'd been putting off for a long time. The patient's name is Sergeant First Class Devin Rourke, she said, still facing the door. Naval Special Warfare. His entry wound was a 7.62 millimeter, which I identified from the wound channel characteristics before the X-ray confirmed it. His exit wound showed keyhole deformation, which means the round was tumbling on entry, fired from medium range, high angle, which tells you about the context of where he was when he was hit. She paused. The clotted drainage I flagged in the ICU was a complication of a hemothorax, not just a pneumothorax. I knew what to look for because I've seen it before, in the field, repeatedly. She turned then and looked at Raymond Holt directly. I know the difference between a hospital and a battlefield, Dr. Holt. I know it better than anyone in this room. She walked out before anyone could respond. Brenda walked with her to the locker room in silence that was heavy with things the woman clearly wanted to say, but had decided wisely not to. Emily opened her locker, took out her bag, her phone charger, a spare pair of shoes, and a photograph she'd taped to the inside of the door. She didn't look at the photograph while she was taking it down. She folded it and put it in the front pocket of her bag. Emily, Brenda said finally. I know, Emily said. I want you to know I didn't push for this. I know you didn't, Brenda. She zipped the bag. She was tired suddenly in a way that went past physical exhaustion into something older. It's okay. She walked out through the staff exit into the Phoenix evening, which was still 94 degrees at 7 in the evening because Phoenix in September had opinions about summer. The heat hit her in the face and she stood on the sidewalk for a moment, bag on her shoulder, deciding which direction to go. Her car was in the staff lot. She started walking toward it. Emily Carter. She stopped. Turned. The man with the silver-brown hair was standing 10 feet away, leaning against the wall near the exit. He'd been waiting. She didn't know for how long, but the quality of his stance said it hadn't been a casual coincidence. You waited out here, she said. Yes. Why? He pushed off the wall and took 2 steps toward her. Up close, in the evening light, he was more clearly military than he'd seemed before, not because of anything he was wearing, but because of what the years had written on him. The lines around his eyes were not just age. She knew the difference. My name is Marcus Webb, he said. I work for a specific entity that I'm not going to name to you in a parking lot. But you need to know that the man you saved twice today is someone we've been trying to keep alive for a particular reason, and the people who put a bullet in him are not done. Emily absorbed this without reaction, or she tried to. That sounds like a problem for whatever entity you work for. It is, but it's also becoming a problem for you. Me. The people who arranged what happened to Rourke, the operation that burned, the team that was compromised, they're looking for who has information. Rourke was supposed to be dead at the scene. He wasn't. Now he's in an ICU at a hospital in Phoenix, and there's a paper trail from this facility that didn't exist 6 hours ago. He paused. You're on that paper trail, Emily. You documented both interventions. Your name is in his chart, twice. The parking lot was quiet around them. A car moved through the far end. Somewhere above, a helicopter passed over, probably a Flight for Life transport heading to the landing pad on the roof. So what are you telling me, she said, that being good at my job made me a target? I'm telling you that the people who shot Devin Rourke are not the kind of people who leave loose ends. She looked at him steadily. What do you want from me, Mr. Webb? Right now, I want to understand who you are. He studied her. Not the file. Not the Harbor Ridge employee record. The whole thing. She should have said no. She should have said that she was on administrative leave, that she had a lawyer she should probably call, that whatever he was building toward was not her problem anymore. She had been doing an extremely thorough job of not making things her problem for going on 3 years. And she had been good at it, and she did not particularly want to stop being good at it. How is he? She asked. Rourke. Stable. The cardiothoracic team did a clean repair. He'll be in the ICU for at least 72 hours. But the attending said, Webb paused, a slight hesitation that she noticed. The attending said if the clot had gone undetected for another 4 to 6 minutes, we'd be having a different conversation. She looked down at the pavement for a moment, then back up. You have somewhere we can talk? She said. He had a vehicle, an unmarked SUV, dark gray, and they drove to a diner 4 miles from the hospital, the kind of place that had been there long enough to have its own atmosphere and was open until 2 in the morning. They took a corner booth. A server who had clearly been working since the early morning brought coffee without being asked, which Emily appreciated more than she could express. There was a second man at the diner, already there when they arrived, already in the booth across from where they sat. Younger than Webb by maybe a decade, with a quiet face and the kind of eyes that were always cataloging. He didn't introduce himself, and Emily didn't ask. She held her coffee mug with both hands. The heat of it through the ceramic felt real in a way the last several hours hadn't quite managed to. You want to know my background, she said. We already know most of it, Webb said. Military Occupational Specialty 68W, 8D equivalent cross-training. You were attached to a Special Forces support element for 14 months. 3 deployments, 2 of them in environments I can't name in a diner in Phoenix. You left the service 8 months after your last deployment. Medical separation, the record says. But the record is thin in the specific places that matter. Emily put her mug down. You've been running me. We ran everyone on the staff when they told us which facility Rourke was being transported to. Standard protocol. And yours was the file that came back flagged. Not because of anything bad. Because of what's in it and what isn't. He leaned forward slightly. You want to tell me what's in the gaps? She was quiet for a moment. Outside, a truck went by on the street, its headlights sweeping across the diner window. The medical separation was real, she said. I had a bilateral shoulder injury from a vehicle incident in my last deployment. Nothing dramatic. I know what you're thinking, and it wasn't a firefight, convoy rollover, the kind of thing that happens all the time and everyone forgets about because nothing explodes. The damage was real, though. It took me out of any role that required physical capacity above a certain threshold. So you got out. I got out. And ended up at Harbor Ridge. I ended up at several places before Harbor Ridge. I took nursing certification courses through the VA program. I worked at a clinic in Tucson for 8 months, then a county hospital in Flagstaff, then Harbor Ridge. She looked at him. I was trying to do something quiet with the skills I had left. Something that didn't require all of this. She gestured vaguely, meaning not the diner specifically. What happened on your last deployment? Webb asked. She had known the question was coming. She had been watching it approach from the moment he said her file was flagged. We were supporting a 12-man Special Forces element running intelligence operations in a province that isn't public. They took contact on an extraction, 4 casualties in the first 90 seconds. She kept her voice level, clinical. It was the only way she could tell it. I was the senior medical asset on the ground. I triaged, I treated, I made calls on who got what resources. We got 3 of the 4 to Cassavac alive. The 4th, she stopped. The 4th was a kid named Terry Bosch, 22 years old. He had a hemothorax I couldn't fully address with what I had in the field, and the Cassavac was delayed because of the threat environment, and he died in my hands before the helicopter got there. No one spoke. I made the right calls, she said quietly. That's what the after-action report says. I made the right calls with the resources I had in the environment I was in. But right calls and the outcome you wanted are not always the same thing, and I spent a long time figuring out how to live in the space between those 2 facts. She picked up her coffee again. So I became a nurse. I took a quiet job in an emergency room, and I tried very hard not to be the person who knew too much and did too much and made people uncomfortable. How's that working out? The younger man said, speaking for the first time. Emily looked at him. Not great, as of tonight. The younger man, and there was something almost like sympathy in his face, buried under the professional composure, nodded once. Webb set something on the table. A folder, thin, manila. He slid it toward her but didn't open it and didn't tell her to open it. Devin Rourke was on a classified intelligence gathering operation when he was shot. The operation was compromised at the source. Someone inside the authorization chain gave up the timeline and the personnel. He wasn't collateral damage. He was the target. Emily looked at the folder without touching it. Why him specifically? Because Rourke is the only surviving member of a team that witnessed something 3 years ago. Something that connects to an internal misconduct investigation that has been suppressed twice at the command level. Webb's voice was steady, unhurried. The people who want him dead are not random. They have access to information that should be classified. They have reach, and they are watching his recovery very carefully. Emily looked up from the folder. You think they have someone inside Harbor Ridge? He didn't answer, which was an answer. She sat back against the booth. The diner hummed around her. Coffee machine, the distant sound of a radio in the kitchen, a couple 2 tables over, talking about something mundane. The ordinary world going about its business, 10 feet from a conversation that was not ordinary at all. I'm on administrative leave, she said. I don't have access to the hospital. We know. I'm not sure what you think I can do. Right now, nothing operational, Webb said. But Rourke is going to be awake and coherent within the next 18 to 24 hours. When he is, he's going to want to know who kept him alive. And there are things he's going to say that we need someone present to hear. Someone who isn't on anyone's radar as an intelligence asset. Someone who can be in that room without raising flags. He paused. A nurse who has a documented reason to check on her patient would not be unusual. I just told you I don't have access. We're working on that. That's not reassuring. I know. He met her eyes. I'm asking you to be in an uncomfortable position for a few more hours while we sort out some things. I'm not asking you to do anything you're not already doing by existing in Rourke's chart twice. She considered that. It was true in its way. The administrative leave didn't erase her documentation. Her name was in the record either way. The decision had already been made for her, by the sequence of events, by the fact that she'd walked into that trauma bay and seen what everyone else had missed. Who else knows about this, she asked. About Rourke's situation? At Harbor Ridge? Webb glanced at the younger man. That's the problem. We don't know. We know the administration was told he was a routine military trauma. We know Holt was briefed at a general level about the security status of the case. Beyond that, Holt was briefed, Emily said. Yes. She processed that. What was he told? That the patient was involved in a sensitive military matter and that discretion was required. Standard language. When was he briefed? This afternoon, before your meeting with Patel. The timeline clicked into place in her head in a way that felt cold and clear and unhelpful. Before the meeting, before Holt had recommended her administrative leave, before Patel had used the words formal review in a voice designed to sound neutral. They put me out of the building, she said. Webb's expression was careful. That may have been coincidental. Was it? He didn't answer that either. Emily stared at the table for a moment. The folder was still there, still closed, still waiting. She put her hand on it without opening it. If I help you with this, she said, I want something in return. What? Information. About what Rourke knows. About what got compromised and how. Because if someone inside this hospital is connected to what happened to his team, she stopped. Something moved in her expression, something she didn't entirely control. Terry Bosch's older brother is currently a staff sergeant in the same battalion where Rourke serves. I need to know if he's in danger. The booth was silent. Webb looked at her for a long moment. Then he said, We'll see what we can do. That's not a yes. No, he said. It's not. But it's not a no either. She took her hand off the folder. I need a few hours. I need to sleep for 3 of them, at minimum, because I've been awake for 19 hours and I'm not useful to anyone operating on this. Then I'll hear whatever you want me to hear. That's reasonable. I also need you to understand something. She leaned forward slightly. I've been doing a careful job of not being dangerous for 3 years. I became a nurse. I took a quiet job. I stopped making people nervous. She looked at Webb directly, and she didn't soften what came next. If you're putting me back in a situation where I need to be the other version of myself, you should be very clear about what you're asking for, because I'm not good at doing that halfway. Webb looked at her. Something in his eyes said he understood exactly what she meant, and that he had maybe been counting on it. Get some rest, he said. We'll reach you at 0600. She slid out of the booth, picked up her bag, and walked toward the door. Outside, the Phoenix night was still warm and dry and indifferent. The sky washed orange near the horizon from the city lights. Her phone buzzed before she reached her car. An unknown number. A text, 4 words, and a room number. He's asking for you. Emily stood on the sidewalk, phone in hand, looking at those 4 words for a long moment. Then she looked up at the sky. Then she turned around and walked back toward the hospital, because some decisions had already been made before you understood you were making them. And the time for turning around had probably been 11 months ago, when she'd taken a job at Harbor Ridge Medical Center and started noticing things that other people walked past. She badged in through the staff entrance, her access still active, whatever Patel had said about the timeline of suspension, and took the stairwell to the 3rd floor because the elevator had a camera and old habits were what they were. ICU 3 was quiet. In the way. ICUs are quiet late at night, not silent, but reduced to the essential sounds of machines doing their work, the low voices of night nurses, the particular antiseptic light that made time feel elastic. She moved down the corridor without hurrying, without looking like someone who wasn't supposed to be there, because the first rule of being somewhere you weren't supposed to be was to act like you were supposed to be there. Rourke's room was at the end of the hall. She pushed the door open quietly. He was awake. His eyes were open and tracking, and he looked bad, the way people in ICUs looked bad. The particular combination of too many lines and too much pallor and the slightly dazed quality that followed anesthesia. But his gaze was clear. Clearer than it had any right to be, given everything. He looked at her. "Carter," he said. Her name, in his mouth, in a voice that was hoarse from the intubation, with an inflection that said not a question, but a recognition. She stepped fully into the room and let the door close behind her. The monitors hummed. Somewhere down the hall, a phone rang twice and stopped. "You know me," she said. Not a question either. "No." He shifted slightly, and she saw the pain move across his face and settle. "But I know who saved my life. Webb told me." He paused. "That's not what I mean. What I mean is, I heard your name and I knew it from something else. From before." She went still. 3 years ago," he said. "There was a support element that pulled 4 of ours out of a contact situation and—" He stopped. His eyes moved to the door, then back to her. And she understood he wasn't finishing that sentence in an ICU room with an open corridor outside. "The medic who worked that scene. We never got a name. There was a debrief report that named the unit, but not the individual. Someone at the command level redacted it." He looked at her steadily. "But I talked to 2 of the guys who came out of that scene. They described the person who ran triage. And when Webb said your name tonight, He stopped. "Was it you?" Emily stood at the side of his bed. The monitors counted his pulse, slow, steady, recovering. "Yes," she said. Something changed in his face. Not dramatic. He didn't have the energy for dramatic, but real. Something complicated moving through him that she didn't try to interpret. "One of my guys died," she said, before he could say anything else. "I need you to understand I know that. Terry Bosch." "I know Bosch's name," Rourke said. "His brother is active duty in your battalion." "I know." And then, after a pause, very quietly, "That's actually why they tried to kill me." The room got very, very still. "What?" she said. Rourke looked at her, and behind the exhaustion and the pain and the particular flatness of a man who'd been through too much to perform anything, his eyes were the eyes of someone carrying something enormous and deciding whether to put it down. "The operation that burned," he said. "It wasn't random. They didn't come after me because of what I saw 3 years ago. They came after me because of what I found out last month." He drew a slow breath, controlled it, made himself continue. "The person who got Bosch killed 3 years ago, the one who compromised that extraction, is still operational, still inside. And I found the name." Emily didn't move. "Who?" she said. And before he could answer, the power in the ICU went out. The darkness lasted 4 seconds. Not a full blackout. The emergency generators caught it before the monitors went completely silent, and the ICU's backup power system kicked in with the low thud of switching circuits that Emily felt more than heard. The room came back in stages. First the monitors, their green and amber lines resuming mid-beat as though nothing had interrupted them. Then the corridor lighting at half brightness, then the nursing station at the far end of the hall where she could hear voices rising in pitch. 4 seconds. She had counted them automatically, the way she had been trained to count things that mattered. She was already at the door. "Stay down," she said to Rourke without looking back. "Do not try to move." "Carter, I mean it." She pressed herself against the wall beside the doorframe and looked through the narrow window into the corridor. The ICU night staff were moving. 2 nurses heading toward the station, an aide standing frozen near the supply room. Normal confusion. Nobody with a purpose that looked wrong. But her hand was at her hip, reaching for something that wasn't there, a reflex from a version of herself she'd been deliberately not being. She turned back to Rourke. He had pushed himself up on one elbow, which she could see was costing him, and his jaw was set with the particular expression of a man who refused to be horizontal when something was happening. "Power failures in ICUs don't just happen," he said. "No," she agreed. "They don't." She pulled out her phone, texted Webb a single word, ICU, then the room number. The response came back in 11 seconds. On it, "Stay put. Do not open the door to anyone you don't recognize." She showed Rourke the screen. He read it. His expression didn't change much, but his eyes moved to the window in the door, and she could see him running calculations, the same kind of calculations she was running, the kind that involved identifying egress points and weighing which of the monitors he was attached to he could afford to disconnect and for how long. "The name," Emily said quietly. "You were about to tell me a name." Rourke looked at her. "If something happens to me in the next hour, nothing's happening to you. Emily." It was the first time he'd used her first name, and the directness of it stopped her. "If something happens, there's a file. It's not physical. It's on a server I set up outside any network that can be officially accessed. Webb has the access protocol. Tell him the phrase is Kestrel November. He'll know what to do with it." "Kestrel November," she repeated. "The name in that file is someone who has been running intelligence from inside a Department of Defense contractor network for approximately 4 years. They compromised 2 operations. Bosch's extraction was the first. There was a second one, 6 months later. Different team, different country. 2 more casualties." He stopped, breathed through something. "I found the connection 3 weeks ago. I reported it up the chain. A week later, someone tried to run my vehicle off Route 17 in Virginia. 2 weeks after that, I got shot in a building in a city I shouldn't have been in, by people who knew my route." Emily absorbed this with the particular stillness that came from hearing something that clarified everything. "Who did you report it to?" she said. Rourke's eyes were steady on hers. "Colonel Daniel Prescott, Joint Special Operations Command, liaison to the Intelligence Assessment Division." She waited. "Prescott is the name in the file," Rourke said. The corridor outside remained quiet for another 7 minutes, which was too long. Emily knew from experience that genuine electrical anomalies in hospital systems generated activity. Maintenance responding, administrators calling, the particular organized bustle of a building diagnosing itself. What she was seeing through the door window was the opposite. The night staff had retreated to the station. The aide had disappeared. The corridor had the quality of somewhere that had been deliberately emptied. She texted Webb again. "Corridor is too quiet. Someone cleared it." His response, "I see it. We have 2 people 30 seconds out. Don't move Rourke." She put the phone away and moved to the monitor rack. Rourke's chest tube drainage was intact. His blood pressure read 104/68, which was low but functional. Heart rate 88. She looked at the IV lines, 2 of them, running fluids and a low-dose pressor. She identified which one she could temporarily clamp without immediate consequence and which one she couldn't. She wasn't moving him anywhere, but she wanted to know the variables. "You're doing a field assessment," Rourke said. "Yes." "Old habit?" "Apparently." He made a sound that might have been a short, broken laugh. "You know what the worst part is? I've been in 3 active combat environments, and I've never been this scared in a hospital." "Most people haven't been shot in a hospital," she said. "I wasn't shot in the hospital." "Not yet," she said, and immediately regretted the phrasing. "That's not— No, you're right to think it. I'm thinking it." He settled back slightly, managed his breathing in the deliberate way of someone managing pain. "What's your read on the power thing? Timed or reactive?" "Timed," she said, without hesitating. "If it were reactive, if someone triggered it because of something that just changed, we'd have had more warning. The ICU doesn't have a single failure point that goes down fast. Someone accessed the maintenance systems, which means they had access in advance. which means this was planned before tonight, before I was transferred here. Or they adapted the plan fast when the original one failed. She glanced at the door. You were supposed to be dead at the scene. When you weren't, they had to improvise a recovery operation. That takes time, but not a lot of time if you have the right resources. Prescott has the right resources, Rourke said quietly. The door opened. Emily was between the door and Rourke in a movement she made without deciding to make it. Her hands were up and empty. Nothing useful in them, but the gesture was real. The stance was real. The absolute readiness behind it was real. The person in the doorway was young, maybe 26, in scrubs that were slightly wrong, too new, no ID badge, shoes that were not clinical footwear. She saw all of this in 1 second. The person stopped, looked at her. His eyes moved to Rourke, then back to Emily. He was holding a syringe. You don't want to do this, Emily said. Her voice was so level it surprised even her. The man's jaw was tight. He was scared. She could see that, which made him more dangerous, not less, because scared people moved wrong. Step aside, he said. No. I said step. The door hit him from behind. Not hard, but enough. It opened into him, throwing his balance, and he stumbled sideways into the wall. Webb came through first, then the younger man from the diner, and the scene resolved itself in about 4 seconds in a way that was not clean and not quiet. There was a crash as the man's elbow hit the monitor stand, a sharp sound from Rourke as the stand shifted and pulled on his chest tube, the clatter of the syringe hitting the floor, and then the young man was on the ground, and the younger agent had a knee in his back and was telling him in a voice of absolute professional calm to stop moving. Emily went straight to Rourke. The chest tube connection was intact. The pull had been enough to cause pain but not displacement. She checked the drainage, checked his pressure on the monitor, checked his breathing. His face was gray and his teeth were clenched, but his oxygen saturation was holding at 93. I'm okay, he said through his teeth. You moved, she said. Someone was about to inject something into my IV. You still moved. She secured the chest tube connection with a piece of medical tape from the supply drawer, not because it needed it, but because it gave her hands something to do while her heart rate came back down from wherever it had gone. What was in the syringe? Webb was crouching over the man on the floor, who was now compliant in the way people became compliant when they understood they had lost. He picked up the syringe carefully with a gloved hand. We'll know in an hour. My guess is succinylcholine or something similar, Emily said. Fast, minimal trace, consistent with looking like a cardiac event in a patient who already had one today. She looked at Webb. They wanted it to look natural. Yes, he said. The younger agent was zip-tying the man on the floor and talking quietly into a radio. From the corridor, Emily could hear movement now. Real movement, purposeful, the sound of people who were supposed to be there arriving. How long has this facility been compromised? She said. Webb stood. He looked tired in a way she hadn't seen before. Not physically tired, but the tiredness of someone whose worst professional scenario had turned out to be exactly as bad as they'd feared. We don't know, he said. We're trying to find out right now. Rourke told me about Prescott, she said. Webb's expression shifted. Something moved through it. Not surprise exactly, more like confirmation of a weight he'd been carrying. I know. You knew. I suspected. Rourke's file led me there. I didn't have proof until about 3 hours ago when our tech team pulled the maintenance access log for this building. The system override on the ICU power was authorized by a contractor access code that traces back to a company with a single DoD client. He paused. Prescott's division. So you have him. We have a thread. Threads aren't arrests. He looked at Rourke. We need Rourke coherent and talking to the right people, with documentation and chain of custody that is airtight, or Prescott's lawyers dismantle it in 48 hours and we're back to zero. Rourke had been listening. His eyes were open and sharp despite everything. Get me a recorder, he said. I'll give you everything, right now. Everything, right now. You need surgery in about 16 hours to close the repair, Emily said. Then we have 16 hours. She looked at him. You lost a significant amount of blood today. You had a cardiac arrest. Your hemoglobin is probably sitting around 7, maybe 7.5. Your blood pressure has been unstable for hours. You are not Emily. Rourke's voice was exhausted, but his eyes were not. I've been trying to get this information to the right people for 3 weeks. 2 men are dead because of Prescott. More might be at risk right now. I am not waiting because my hemoglobin is 7. He held her gaze. I'm asking you, is it safe enough for me to talk for an hour? She wanted to say no. She ran the actual clinical math and arrived at an answer she didn't love. Lying flat, monitored. If your pressure drops below 90 systolic, we stop. Done, he said. I mean it. I know you do. And then quietly, I know exactly what you mean when you say things, Carter. I've known since that trauma bay. Webb brought in a compact recording setup that looked like nothing in particular, and for the next 53 minutes, Devin Rourke talked. His voice was uneven in places, interrupted by pain, occasionally losing threads and then recovering them with visible effort. He was not a neat narrator. He repeated himself twice on the same detail about a contractor invoice, got frustrated with himself, and had to stop for 4 minutes while Emily managed a blood pressure dip, 87 systolic, which she had said was the line. And so she told him to stop talking, and he stopped, just like that, no argument. And then the pressure came back to 94, and he picked up where he'd left off. He gave them dates, locations, personnel designations, operational code names. He gave them the specific chain of communication he'd identified, how Prescott had been moving intelligence out through a contractor's encrypted messaging system that was technically internal but had a secondary backdoor built into its architecture. He gave them the 2 operations that had burned and the specific decision points within those operations where the compromise had been decisive. He gave them the name of a lieutenant colonel at a domestic base in Virginia who he believed was either complicit or being used without knowing it. Emily sat in the corner of the room for most of it, monitoring his vitals, and listened to the shape of what had been happening for 4 years, and felt the cold, specific clarity of understanding how Terry Bosch had died. Not bad luck. Not the chaos of a firefight in an impossible environment, a decision made by a man in an office in Virginia who had traded lives for money or leverage, or whatever it was, that made a person worth something to the wrong people. When Rourke was finished, Webb sat back in his chair and was quiet for a moment. That's enough to move on, he said. How fast? Rourke asked. The secretary's office has been briefed as of 2 hours ago. A federal warrant is in process. Prescott doesn't know we're this close. He thinks the hospital operation tonight was going to resolve the problem. It didn't, Rourke said, looking at Emily. No, Webb said. It didn't. Emily was looking at the monitor. His pressure had stabilized at 96/61. Not great. Stable. She stood up from the corner and moved to his IV, adjusted the fluid rate. I want to be there, she said. Both men looked at her. When you move on Prescott, I want to know it happened. Emily, I'm not asking to be in the room. I'm asking to know. She looked at Webb. Terry Bosch was 22 years old, and he died holding a tourniquet that wasn't enough because someone sold the timeline of his extraction to people who wanted him dead. His brother is in the same unit right now. I want to know when the person responsible is in custody. Webb held her gaze for a long moment. You'll know, he said. At 3 a.m., a woman arrived at Harbor Ridge Medical Center who did not belong to any department Emily had ever worked in. She came with Webb, and she wore a federal identification that she showed to the night administrator with the kind of calm that made people stop asking questions. Her name was Agent Lorraine Taft, and she was from a division of the Department of Justice that Emily didn't need explained to her. Behind Taft came 2 other agents, and behind them came a man in uniform, a 2-star general named Whitmore, whose name Emily had heard once, 3 years ago, in a debrief that she hadn't been supposed to be present for. She was standing in the ICU corridor when they arrived, and General Whitmore stopped when he saw her. He was a tall man, maybe 60, with a face that had the weathered quality of someone who had spent years in places where the weather was the least of the problems. He looked at her for a moment, and there was something in his expression she couldn't fully parse. Recognition that wasn't the kind that came from meeting someone, but from knowing about someone. You're Carter, he said. Yes, sir. You were the medic on the Haverfield support element in 2021. She had not heard the name of that operation spoken aloud in 3 years. It landed strangely, like hearing a word in a language you'd tried to forget. Yes, sir. Whitmore nodded once, slowly. That after-action report had your contribution redacted on a recommendation I didn't authorize and couldn't trace at the time. He glanced at Webb. Now I can trace it. Emily said nothing. She wasn't sure there was anything to say to that. I owe you an explanation, Whitmore said, and an apology. But those can wait until this facility is secure and Sergeant Rourke is stable. He looked past her toward the ICU. Is he talking? He talked, she said. He gave Webb everything. Something shifted in Whitmore's posture. Not relief exactly, but the particular quality of a weight redistributing. Good. He looked back at her. Stay close, Carter. We're going to need a statement from you as well. About tonight? About tonight. And about 2021. He held her gaze. Both. She was still processing this. The strangeness of standing in an ICU corridor at 3 a.m, being told that a redacted report was getting unredacted, that 3 years of silence were about to get reviewed, when she heard raised voices from somewhere below her. The 4th floor. The administrative floor. She looked at Webb. Taft has a warrant for the hospital's communication records, he said. Full digital forensics going back 18 months. Someone tipped off the administration that federal agents were in the building. Holt? She said. Don't know yet. The voices got louder. Emily heard Raymond Holt's voice specifically. She knew it well enough to identify the register of it, the controlled authority cracking slightly at the edges. And she heard a woman responding in a tone that did not yield. She looked at the stairwell door. She looked at Webb. Go, he said. She went. The 4th floor hallway had the bright midnight quality of a building that had been woken up. Lights on in Patel's office. Lights on in the administrative suite. 2 federal agents flanked the corridor entrance with the particular stillness of people who had already made the space theirs. Taft was in the center of the hall, holding documents, facing Raymond Holt, who was in a suit jacket he had clearly put on fast. One side of the collar was half down, and who was using his professional voice at full volume. This is outrageous, he was saying. You cannot come into this facility without notification to legal counsel. The warrant covers this facility and all electronic records generated within it in the last 18 months, Taft said, with the specific flatness of someone repeating something they were not going to repeat again. The facility's legal counsel has been notified. They were notified at 2:45 a.m. If they haven't reached you yet, that is between you and them. On whose authority? Department of Justice, signed by a federal magistrate at 1:17 a.m. this morning. Taft offered the documents. You're welcome to read it. Holt did not take the documents. His eyes moved past Taft and landed on Emily, who had stopped at the edge of the corridor. Something moved through his face. Not guilt exactly. She wasn't sure Raymond Holt operated in guilt, but a rapid recalculation, the look of a man who had just realized that the variables in the room were not what he'd thought they were. Miss Carter, he said, you shouldn't be here. You're on administrative leave. She's here at my request, Webb said, coming up behind Emily. And who exactly are you? Webb showed him a credential. Holt looked at it. The color in his face changed slightly. I don't understand what's happening, he said, and for the first time Emily had known him, he sounded like he genuinely didn't. Dr. Holt, Taft's voice was measured. When were you contacted by Colonel Daniel Prescott's office regarding the patient in ICU 3? The hallway was very quiet. Holt looked at the warrant, at Taft, at Webb, at Emily. I received a call this afternoon from someone identifying themselves as a Department of Defense liaison. They asked me to keep the patient's admission low profile and to limit nursing access to the ICU. To limit nursing access, Webb said. Specifically, they asked that the nurse who had documented the patient's care be kept away from further contact. Holt's voice had changed. The authority was gone from it. What was left was something that sounded almost bewildered. They said it was for security reasons, for the patient's protection. Emily watched him. He hadn't known, she realized. He'd made it easy for someone to use him because his ego had made him easy. Because his willingness to remove Emily from the equation had aligned so conveniently with what someone else needed that he hadn't questioned it. He'd been a tool without knowing he was being used as one. That did not make her feel better. It just made it more complicated. We're going to need your full account of that communication, Taft said. Every detail you remember. Tonight. Holt looked like he wanted to say something else. He looked at Emily again, and whatever he had been about to say dissolved, because she could see in his expression that he was beginning to understand the shape of what had happened around him, and it was not the shape he'd thought it was. "I'll cooperate fully," he said, finally. Taft nodded to one of the agents. "Conference room." As they moved down the hall, Holt stopped beside Emily. He opened his mouth, closed it, tried again. "The patient," he said. He's alive," she said. "He's stable." Holt nodded. He looked old in a way he hadn't looked this morning. "You were right," he said. "In the bay. You were right." She had imagined this moment before in a vague and unexamined way, the way you imagine things you told yourself you didn't need. She had imagined what it would feel like to have Raymond Holt say those words. She had expected it to feel like something. It didn't feel like much. "I know," she said, and let him walk past her. By 4:30 a.m., the federal forensics team had pulled the hospital's communication logs and identified the spoofed contractor access code that had triggered the ICU power failure. The code resolved to a shell company, 3 layers of it, which was thorough, but not thorough enough for the kind of resources Taft's team was running. By 5 a.m., that shell company had been traced to an infrastructure subsidiary that shared a parent entity with the DoD contractor at the center of Rourke's recorded testimony. Emily sat in the break room on the 3rd floor and drank bad coffee because there was nothing else available, and listened to the building do what buildings do when federal investigators are taking them apart piece by piece. Footsteps. Voices. The occasional sharp instruction. The rolling of equipment carts. Webb found her at 5:15. He sat down across from her and didn't say anything for a moment, which she had come to understand was his way of organizing information before he delivered it. "We have a location on Prescott," he said. "He's in the D.C. area. A federal team is executing the warrant as of 20 minutes ago." She put her mug down. "It's moving fast," she said. "Once it moves, it has to move fast. If he gets word, he'll run. Or worse." Webb looked at her steadily. "There's something else. The forensics team found a secondary communication. It went out of the hospital's network at 11:47 p.m. tonight, before the power event. Someone inside this building sent a location confirmation." "To Prescott's network?" "Yes." Emily sat with this. "It wasn't Holt." "No, it wasn't Holt." Webb looked at the table for a moment. "It was a network-connected device in the hospital pharmacy. Access card shows the login was registered to an employee who has been on leave for 6 weeks. Someone used their credentials. Or someone inside who had access to their credentials." "Yes." "So there's still someone in this building." "Was," Webb said. "The pharmacy employee who actually used the terminal tonight, the one whose physical access card was logged, has been identified. They're being detained as we speak." Emily felt the long shape of the night finally beginning to resolve into something with edges. She was very tired and her shoulders hurt, and the coffee was genuinely terrible. And somewhere in the ICU above her, Devin Rourke was sleeping under the monitoring of 2 federal agents and the night ICU nurse. And somewhere in Virginia, a federal team was knocking on a door. She was about to say something when her phone buzzed, a number she didn't recognize. She looked at Webb, who nodded. She answered. "Carter?" The voice on the other end was female, flat, professional. One of Taft's people, probably. "We need you back in ICU 3. The patient is asking for you and we have..." A pause, and something in the pause was wrong. The texture of it, the slight compression of what was happening on the other end. "We have a situation." Emily was already standing. "What kind of situation?" The cardiothoracic attending who was supposed to evaluate him at 0600 arrived early. Dr. Marcus Henley. He's in the room now, but Rourke is refusing the evaluation and saying, another pause. He's saying he doesn't recognize him. He's saying Henley wasn't his doctor. Emily's hand tightened on the phone. Henley had been on call for the cardiothoracic consult. She had never met him. She knew his name from the chart. "Who cleared Henley to enter that room tonight?" she said. "The duty administrator approved his access." "Which duty administrator?" Silence. "Which duty administrator?" she said again, harder. We're checking." Emily was already running. She hit the stairwell at a run. 3 flights. Her footsteps on the concrete were loud and she didn't care. She was doing the math as she moved. Rourke's room was at the end of the ICU corridor. The federal agents Webb had stationed there were competent, but they were not medical personnel and would not know from looking at a man in scrubs with a cardiothoracic consult order whether the threat was procedural or immediate. Rourke knew. He'd flagged it. That was the only reason she had 30 seconds instead of 0. She came through the stairwell door onto the ICU floor and turned the corner and saw the door to Rourke's room standing open and 2 federal agents in the corridor outside it with their hands not quite at their sides, the particular posture of people deciding whether they had cause to act. Inside the room, a man in scrubs was standing at the IV pole. Emily walked through the door. "Step away from that IV," she said. The man turned. He was maybe 50, with a trim gray beard and the specific kind of unhurried expression that came from either genuine calm or the performance of it. He was holding a chart. He looked at her the way physicians look at nurses who've interrupted them, with the reflex condescension of professional hierarchy. "I'm Dr. Henley," he said, "cardiothoracic. You're interrupting a consult." "I know who you said you are," Emily said. She moved between him and the IV pole in 3 steps, positioning herself so that her body was the obstacle. "Step away from the IV." Rourke was watching from the bed. His face was pale and set, the expression of a man who'd been managing a situation while waiting for backup. His right hand was curled around the call button. The man looked at Emily for a moment. Then he looked at the 2 agents in the doorway who had come 1 step into the room. Then he looked at the chart in his hand, and something moved across his face. A recalculation, the kind that happened fast when the variables shifted. "This is completely inappropriate," he said. "I was authorized to see this patient." "By whom?" Emily said. He opened his mouth. "Name," she said. "Who authorized your access to this room tonight?" He said a name. "The duty administrator." A woman whose name Emily recognized from the hospital directory, but had never interacted with directly. "Check it," Emily said to the agent on her left, without looking away from the man in front of her. The agent stepped back into the corridor. She could hear him on his radio. The man with the chart had not moved. He was still holding it, still performing the affect of an interrupted physician, but the performance had developed a fracture in it, something slightly too controlled, slightly too committed to holding the pose. "Where did you train?" Rourke said from the bed. The man looked at him. "I'm sorry?" Cardiothoracic surgeons like to talk about where they trained, which program, who they worked under. It's like a handshake. Rourke's voice was rough but deliberate. "Where'd you train?" A pause that lasted exactly 1 beat too long. "University of Michigan, Dr. Calloway's program." "Calloway retired in 2019, Emily said. She did not actually know this with certainty, but she said it with the precision of someone who did, watching his eyes. His eyes moved. A small movement, but it moved. "I was still active when I—" "Agent," Emily said. The agent on the right was already moving. The man dropped the performance the moment the agent's hand came up, and he took 1 step backward toward the window. Not toward the door, toward the window, which on the 3rd floor was sealed. And then he stopped because there was nowhere to go, and he was not, in the end, trained for physical confrontation. He was trained for something quieter. He stood against the wall with the chart still in his hand and his jaw tight and said nothing else. The agent from the corridor came back through the door. The duty administrator on record for tonight's access approvals was logged out of the system at 11 p.m. Her credentials were used at 4:58 a.m. to authorize the consult visit. She's been home since 11. We just reached her by phone. Emily looked at the man against the wall. He looked back at her with an expression that had finally settled into something honest. Not remorse, not confession. Just the flat recognition of a man who had run out of moves. "Cuff him," Webb said from the doorway. She hadn't heard him arrive. He was breathing slightly faster than normal, which was the only sign that he'd also taken the stairs. He looked at the man against the wall with the specific expression of someone who had been looking for them for a while. "Who sent you?" Webb said. The man said nothing. "Was it Prescott directly or through the contractor network?" "Nothing." "We have the pharmacy communication log," Webb said. "We have the spoofed access credentials. We have your photograph entering this building at 4:41 a.m. We have a syringe that is currently being analyzed in a federal lab." He paused. "You can talk to me now, or you can talk to the DOJ in a room with no windows. But you're going to talk." The man's eyes moved to Emily. Not to Webb, not to the agents, to Emily. She didn't know what he was looking for in her face. Whatever it was, she didn't give it to him. "Get him out of here," she said, and turned back to Rourke. Rourke's blood pressure was 91/63, which was where it had been, which meant the encounter hadn't destabilized him physiologically, even if every other measure of the situation had been deteriorating for the last several hours. She checked his chest tube, output minimal, draining correctly. His temperature was 37.8, slightly elevated, which she noted but didn't panic about. His oxygen saturation was 94 on 2 liters of supplemental oxygen. He watched her work through the check with the patience of someone who had learned that being checked on was not the same as being weak. His credentials, he said? Fabricated, she said, or borrowed, we'll know which. He was going to push something through the IV. Yes. What would it have done? She considered how much clinical honesty was warranted. Fast acting, something that would have looked like cardiac arrhythmia in a post-operative trauma patient. It would have been documented as a complication. Rourke absorbed this. They really don't quit. No. She adjusted his oxygen tubing. But they're running out of assets. That's 2 failed attempts in one night. They had limited operational capacity to begin with. Prescott wouldn't have risked more than a small, deniable team for something this sensitive. They've burned both of them now. You sound like an analyst. I sound like someone who's been awake for 22 hours and is running on bad coffee and pattern recognition, she said, and he almost smiled. Webb appeared in the doorway again. His phone was in his hand and his expression had the particular quality she'd started to recognize, controlled, but with something moving underneath it. Virginia team has Prescott, he said. The room was quiet for a moment. When? Rourke asked. 20 minutes ago. He was at his residence. He did not go quietly. There's going to be a report about a vehicle incident in a residential neighborhood in McLean at approximately 5 a.m., but no one was seriously injured. He's in federal custody as of 5:23 a.m. Webb looked at Rourke directly. It's done. Rourke closed his eyes. Not in relief exactly. It wasn't a peaceful expression. It was the expression of someone setting down something they'd been holding for a very long time and feeling the weight of it in the absence. Kestrel November, he said. I know, Webb said. The file is secured. We pulled it 2 hours ago. It's been transferred to the DOJ team. Everything's in there. All of it. I know. Webb's voice was quieter now. We know. Emily stood at the side of the bed and looked at her patient and said nothing, because there was nothing to add to that, and sometimes the right thing was to let a moment be what it was. At 6:15 a.m., the sun was coming up over the east parking structure, the orange light coming through the windows of the ICU in long horizontal strips that didn't improve anything aesthetically, but made the room feel less like the inside of a difficult night. Emily was writing a nursing note, which she technically had no current authority to do, given the administrative leave, but which she was doing anyway because the documentation of Rourke's night needed to be accurate and complete, and she was the one who had been there for most of it. Agent Taft found her in the charting alcove outside the ICU. We're going to need a formal statement from you, Taft said, pulling a chair up and sitting across from her with the directness Emily had come to respect about her. About both incidents last night, the impersonator and the original power event, and about your interventions earlier in the day. Okay, Emily said. This is going to generate some attention, Taft said. The investigation into Prescott's network is going to be federal. The trial, when it comes, will be federal. Your name is going to be in documents that will eventually become part of the public record. Emily looked at her. I know. I want to make sure you understand the scope of what that means. You won't have a lot of control over how the story gets told once it's in the record. With respect, Emily said, my name has been in Rourke's chart since yesterday morning. It was already there. Someone already tried to remove me from the building because of it. She put her pen down. I stopped trying to control the story a while ago. What I care about is whether it's accurate. Taft studied her. General Whitmore wants to speak with you at 0800. He's bringing someone from the JAG office and someone from the Inspector General's division. About 2021. About 2021, about the redaction, about what you were doing when you were doing it, and what happened afterward. Taft paused. He used the word rectification, specifically. Emily sat with that word. It was not a small word. It meant something specific in military context, not just an apology, but a formal acknowledgement and correction of record. She had not expected that. She had told herself she hadn't wanted it. Now that it was in front of her, she wasn't sure what she felt about it, which was its own kind of answer. Okay, she said. Taft nodded and stood. She was almost out of the alcove when Emily said, "The man they detained tonight, the one posing as Henley. Do you know yet who he actually is?" Taft turned. "Name is Foster Greer. He's a private contractor with a background in intelligence operations and a CV that reads like someone designed it to look like nothing. He's been on a watch list for 18 months, connected to 3 prior operations that we suspected were Prescott adjacent but couldn't prove." She paused. "He's talking. He started talking about 40 minutes ago, actually. He's not loyal to Prescott. He was a hired asset. He wants a deal, and he has information that is apparently worth having." "Is it?" "It's worth having," Taft said, and the way she said it meant yes, substantially. After she left, Emily sat in the alcove for a few minutes and did not write anything. She looked at the charting screen. She looked at Rourke's vitals on the monitor at the far end. She thought about Terry Bosch in a building on the other side of the world, 3 years ago, and about the specific sound a man's breathing made when it was almost done. She thought about the 23 seconds between when she'd known he wasn't going to make it and when the helicopter had finally appeared on the horizon. She had counted those seconds too. She counted a lot of things. It was a habit she'd never been able to stop. She finished the nursing note. She signed it with her name and her credentials and the timestamp, and she submitted it into the record. Then she went to find coffee that was better than what the break room had. The shift change happened at 7 a.m., and the day staff arriving had the particular quality of people walking into a situation they knew was different from what they'd left the day before. There were federal agents in the building. There were people in suits in the administrative corridor. There was a story moving through the staff channels in the fragmentary way stories moved. Pieces, impressions, the name Rourke said by people who didn't know who he was, the name Prescott said by people who didn't know why it mattered. Emily was standing at the coffee cart near the main entrance when Victor Gaines arrived. He was 10 minutes early, which was his habit. He saw her before she saw him, and when she looked up, he was already stopped, looking at her with the expression of a man cataloging a lot of information at once. "You look like you haven't slept," he said. "I haven't." He poured himself coffee, stood beside her. The atrium was filling up with the morning shift, nurses, techs, the early rounding residents with their cups and their tablets. "I heard there are federal agents in the building," he said. "There are." "Connected to the military patient?" "Yes." Victor was quiet for a moment. "Are you okay?" She considered the question. It was a simple question that did not have a simple answer, and Victor deserved more than a reflexive response. "I think so," she said. "Ask me again in 48 hours. He nodded, and she could see him deciding whether to push further. He decided not to, which was the right call. "They're saying Holt was in a meeting with federal agents most of the night." "He was." Is he in trouble?" She thought about how to answer this accurately. He made it easy for someone to use him. I don't think he knew what he was facilitating. Whether that's a legal problem for him or just a professional one, I don't know yet. Victor processed this. "So he's not the villain." "He's not the villain," she said. "He's something more complicated than that." Victor looked at her over his coffee. "And you? The administrative leave?" "I don't know yet," she said, which was the truth. Everything in the last 12 hours had been about the immediate threat and the federal response to it. The hospital's own internal situation was still where she'd left it at 7 p.m. the previous evening, formally unresolved, documented, pending review. "For what it's worth," Victor said, "after the word got around about what happened last night, about the ICU code and the power thing and the—" He paused. "There are people on this floor who are going to want to say something about what you did." She looked at him. "Good things," he said, in case that wasn't clear. She had not expected to feel anything about that either, and she felt something anyway, which was inconvenient. She looked at her coffee cup. "Thanks, Victor," she said. He patted her shoulder once, awkward and genuine, and went to clock in. The 0800 meeting with General Whitmore happened in the same fourth-floor conference room where Patel had placed her on administrative leave 12 hours earlier. The room looked identical and felt entirely different. Whitmore sat at the head of the table. To his right, a JAG colonel named Reyes with a legal pad, and the organized expression of someone who had reviewed documents on the drive over. To Whitmore's left, a woman from the IG's division named Sutherland, who had the specific quality of someone whose entire professional function was finding where the record had been tampered with. Patel was also in the room. She sat near the window, not at the table, which was its own statement about the repositioning of authority that had occurred overnight. She had the expression of someone who had been awake as long as Emily, but had spent that time differently. Not in a crisis, but in a slow, accumulating realization of the shape of things. Emily sat across from Whitmore. "I'm going to be direct," Whitmore said. "The redaction on the Haverfield Support Element After Action Report was made in June 2021 by someone operating under Colonel Prescott's indirect authority. The redaction removed specific identification of the medical personnel who provided trauma care during the extraction contact. It removed your name, your credentials, and your clinical decisions from the official record." Emily said nothing. That redaction was not authorized at any level above Prescott's operational influence. It should not have happened. The record that exists, the one that was accessible to anyone who reviewed your service history, is incomplete in a way that materially misrepresents your contribution and your capability. She looked at him. "Is that why my file came back flagged when Webb ran it?" "Partly," Whitmore said. "The gaps were unusual. Gaps of that nature in a record of someone with your training are unusual. It suggested either administrative error or deliberate suppression." He paused. "We now know which one." Sutherland spoke. "We're going to be correcting the record today. Formally. The full after-action documentation will be restored and the redaction will be flagged and reversed. This will be part of the official record of the investigation into Prescott's conduct. Your service record," Reyes added, "will be amended to reflect the full scope of your clinical actions during the Haverfield deployment and the specific commendation that was recommended by the Special Forces team commander at the time and was suppressed along with the rest of the documentation." Emily looked at Reyes. "There was a commendation. Recommended, not processed. It was in the draft record that Prescott's office got to before it moved up the chain." Reyes's voice was measured, professional. "It will be processed now." She sat with this. The room was quiet. Through the window behind Patel, the Phoenix morning was getting on with itself. Blue sky, hard light, the distant movement of cars in the parking structure. She had not known about the commendation. She had known about the redaction in the vague, intuitive way you knew things that no one confirmed, because the silence around a subject was sometimes louder than the subject itself. But the commendation was new information, and it landed differently from the rest. "There's something I want to say," Emily said. Whitmore looked at her. "Go ahead." "Terry Bosch. His name should be in the corrected record, not just as a casualty notation. His name should be in there with the full circumstances, because the full circumstances now include the fact that what happened to him was not a random operational failure. It was the result of a deliberate compromise." She held Whitmore's gaze. "His family deserves to know that. His brother deserves to know that." Whitmore was quiet for a moment. "Staff Sergeant Aaron Bosch has already been contacted through his chain of command, as of 2 hours ago." Emily absorbed that. "He was told?" "He was told what we could tell him at this stage of the investigation. More will follow as the case develops." Whitmore's voice was not soft exactly, but it was careful. "He asked about the medic on the ground in 2021, by name." She looked at the table. "He wanted to know if you knew his brother," Whitmore said. She was quiet for a moment. Outside, a phone rang somewhere and was answered. "Yes?" she said. "I knew him. He was 22 years old and he was calm the whole time. Even at the end, he was calm." She stopped. "Tell Aaron that, if it means something to him." Whitmore nodded once, slowly. Patel spoke for the first time. Her voice was careful. "Emily, I want to—" She stopped. Started again. "The administrative leave, the review process that was initiated yesterday. Given the circumstances, we'll address the hospital's internal matters separately," Whitmore said. He did not say it harshly, but he said it clearly. There was a specific, polite authority in it that made it not a suggestion. Patel nodded. "Dr. Patel," Emily said, "it's okay." And she meant it, more or less. Not because what had happened was fine, but because holding the weight of it on top of everything else in the last 20 hours was a calculation she'd already made and settled. Patel looked at her. There was something in her expression that was more than professional, something human in it, the discomfort of a person who had made a reasonable decision based on incomplete information and had been watching the completeness of the information reveal itself for the last 12 hours. It's not okay, Patel said quietly. But thank you. At 9:30 a.m., Dr. Sandra Voss found Emily in the hallway outside the ICU. Voss was in surgical scrubs, which meant she'd been in the OR or was heading there, and she stopped in the middle of the corridor with the directness Emily had always appreciated about her. I heard about last night, Voss said. All of it. Word travels, Emily said. In this building, it travels at about the speed of a hospital intercom. Voss looked at her. The tension in that bay yesterday. When you called it, I want you to know that I had seen it, a few seconds before you said it, but I had been… She stopped. I had been about to wait for the X-ray, because that's what the protocol says. And I would have waited. Emily looked at her. You made the right call when it mattered. Because you pushed. Because you listened, Emily said. Those aren't the same thing, but they're both part of it. Voss looked at her for a moment. Then she said something Emily had not been expecting. I trained under a combat surgeon. Did a rotation with a military medical unit in my residency. 12 weeks. It nearly destroyed me, and it was also the best thing I've ever done professionally. She paused. I knew, when I watched you in that bay, that you hadn't learned what you knew in a nursing program. Emily said nothing. I didn't say anything yesterday, Voss said. I should have. I don't have a good explanation for why I didn't, except that the politics of this department are… She made a brief, tired gesture. Complicated. But I want you to know I saw it. Thank you, Sandra, Emily said. Voss nodded. She started to walk away, then stopped. When this is done, when the federal situation settles and you're back on the floor, I'd like to talk to you about the trauma protocols. The current ones are outdated in 3 specific places, Emily said. Voss almost smiled. Yes. She paused. We'll talk. She walked toward the surgical wing. Emily watched her go, sen. At 11 a.m., Webb came to find her in the room she'd been given to use for the morning, a small office off the administrative corridor that belonged to someone on vacation, with a desk and a chair and a window that looked at a wall. He sat down in the second chair without being asked. He looked like a man who had been awake for 24 hours and was functioning on the professional's ability to defer the physical consequence of that until a later, inconvenient moment. Update, he said. Go ahead. Prescott is in federal custody in Virginia. He's lawyered up, which was expected. The case against him does not depend on his cooperation. Rourke's testimony and the file documentation are sufficient to open the federal prosecution, and the contractor network evidence adds a secondary track that's independent of anything Prescott says or doesn't say. He paused. Greer, the man who came into the ICU last night, is actively cooperating. He's given us 2 names in Prescott's domestic network and a third in the contractor company's operations division. Those people are being picked up today. The pharmacy employee, Emily said, detained. That one is more complicated, but preliminary indication is coercion rather than willing participation. We'll see. Emily nodded. And Rourke? Heading into surgery at 1 o'clock. The cardiothoracic team, the actual one, has reviewed his imaging and the repair from last night. They're confident, 6 to 8 weeks of recovery. He'll be inpatient by week 2, Emily said. I have no doubt. Webb looked at her steadily. How are you doing? You're the second person to ask me that today. What did you tell the first person? That I'd know in 48 hours. That's probably accurate, he said. I was quiet for a moment. The investigation is going to be long. Prescott's network was not small, and the contractor connections go wider than the 2 operations Rourke documented. There's going to be a period where this is loud. Press, political attention, the whole thing. He looked at her carefully. Your name is going to be part of the public story eventually. Taft told me. How do you feel about that? She thought about this honestly. I feel like I spent 3 years trying to be someone who didn't generate attention, and I failed at that in about the most comprehensive way possible. You saved a man's life, Webb said. Multiple times, technically, in 1 day. I know. Does that help? She looked at him. Ask me in 48 hours. He almost smiled. There's one more thing. He set a document on the desk. It was brief. 2 pages. Official letterhead she recognized from the morning meeting. The amended service record notation. Her name, her credentials, her clinical actions on the Haverfield deployment. The commendation, formally processed. And below that, a separate sheet. A letter, also formal, from General Whitmore's office, addressed to the Chief Medical Officer of Harbor Ridge Medical Center regarding the employment status of Emily Carter, RN, and the circumstances of her recent administrative review. She read it. The letter did not order Harbor Ridge to do anything. That was not within military jurisdiction over a civilian hospital, but it documented clearly and in formal language that the administrative action taken against Emily had occurred under circumstances that had since been revealed as compromised, and that her clinical decisions on September 14th had been consistent with exceptional training and had directly preserved the life of a federal military asset in ways that merited recognition rather than sanction. It was not a job reinstatement, but it was something that made a job reinstatement very difficult to avoid. She put the letter down. Whitmore wrote this himself, Webb said. I can tell, she said. The language was direct and slightly old-fashioned in the specific way of a person who wrote their own communications. He wants to meet Rourke before the surgery, 10 minutes. He asked if that was medically reasonable. If it's actually 10 minutes, she said. He's a general. He means 10 minutes. Then yes, she said. It's reasonable. She stood up. She picked up the commendation page and looked at it for a moment. Not at the formal language, but at her own name, written there, connected to what she had done and not erased. She put it in her bag. I want to be there when Rourke goes into surgery, she said. You're not his surgeon. I know. She picked up her jacket. I'll stand outside the OR. He'll know I'm there. Webb looked at her for a moment. Carter, he said. She looked at him. For what it's worth. What you did yesterday. From the trauma bay to the ICU to that room at 5 a.m. He paused, choosing his words the way she'd noticed he chose words when they were going to matter. I've worked with a lot of people in a lot of situations. That was... He stopped. That was something. She held his gaze. Thank you, she said, simply. She was almost at the door when her phone buzzed. She looked at it. An internal Harbor Ridge number, Patel's direct line. She answered. Emily, Patel said, I need you to come to my office. There's someone here. A pause. Dr. Holt is here. He's asked to speak with you directly. He has... Another pause, longer. He has something he wants to give you, something he found in the patient communication log review this morning. He says you need to see it before anyone else acts on it. Emily's hand tightened on the phone. What is it? She said. He says it's a communication that went into the hospital system 6 days ago, before Rourke arrived, before any of this. He says it has your name in it. Patel's voice was careful, controlled. Emily, it was addressed to you. Someone sent a message to Harbor Ridge, specifically to the nursing staff directory, specifically flagged to reach you. It was intercepted in the administrative filter and never delivered. Emily stood in the doorway of the small office. What does it say? She said. Patel read it aloud. It was 11 words. 11 words that rearranged everything she had understood about how yesterday had begun, about how she had come to be in that trauma bay at the moment Devin Rourke arrived, about whether any part of the last 24 hours had been as random as it had seemed. She stood very still. Emily? Patel said. Are you there? I'm here, she said. Don't let Holt leave. I'm coming up. She took the stairs again. Not because she was running this time, but because she needed the 30 seconds of stairwell between the 3rd floor and the 4th to do something with the 11 words Patel had just read to her. To let them settle into a shape she could think around, because right now they were sitting in the center of her chest like something physical. The message, sent 6 days ago, intercepted in the administrative filter, never delivered. They're sending Rourke to you. You're the only one who can keep him alive. 11 words. No sender name, stripped at the routing level, which meant someone who understood hospital communication infrastructure well enough to know how to move through it, and well enough to know it would eventually be found, which meant the anonymity was not the point. The message was the point. The delivery was the point. Someone had known 6 days ago that Devin Rourke was coming to Harbor Ridge. Someone had known he would need her specifically. And someone had decided that the best way to make sure she was ready was not to call her directly, not to reach her through any channel that could be traced or intercepted by the people trying to kill him, but to send 11 words into a hospital's staff directory and trust that she would either receive them or that she wouldn't need them. That her own instincts, her own eyes, her own 22 hours of functioning on muscle memory, and 3 years of deliberately suppressed capability would be enough. They had been right. She pushed through the fourth-floor door. Paddle's office had a glass panel beside the door, and through it Emily could see Holt sitting in one of the chairs across from Patel's desk. He was leaning forward with his elbows on his knees, which was not a posture she had ever seen Raymond Holt use. He looked like a man who had spent the night revising something he'd believed for a long time. She went in. He looked up when the door opened. He started to stand and she waved a hand, not unkindly, just efficiently, and he sat back down. Patel slid the printed communication across the desk. Emily picked it up and read it, even though she'd already heard it, because reading something was different from hearing it, and she needed both. They're sending Rourke to you. You're the only one who can keep him alive. The filter log shows it came in on September 8th, Patel said. It was flagged as an unverified external communication because it bypassed the standard sender authentication. The system quarantined it automatically. Has Webb seen this? Emily said. Not yet. You're the first. She looked at Holt. He was watching her with the expression of a man doing something difficult and not pretending it wasn't difficult, which she gave him credit for. Why did you bring this to Patel? She said. Because I found it in the communication review that Taft's team ran last night, he said. They pulled 18 months of logs. When I saw your name in the quarantine folder with that timestamp and that content, He stopped. I could have sent it directly to the federal team. I chose to bring it here first because I thought you should know before it became part of the official record without your being aware of it. He paused. It was the least I could do. Emily looked at him. The least I could do was doing a lot of work in that sentence. She heard everything under it. The professional review that had been initiated against her at his recommendation, the administrative leave. The specific and repeated instruction to stay in her lane, delivered to a person whose lane had, it turned out, included everything that mattered in the last 24 hours. Do you know who sent it? She asked. No, the sender routing is clean. Whoever sent it knew what they were doing technically. He met her eyes. My guess, and it's only a guess, is someone inside the intelligence apparatus who knew about Prescott and about the operation and didn't have a clean channel to raise the alarm, but knew enough about you to know that getting you into position was the next best option. Someone who knew about the Haverfield redaction, she said. Holt looked briefly confused. There were people who knew what was in my service record before it was redacted, she said. The Special Forces team commander, a few others. If one of them had been tracking Prescott's network, had seen the operation developing, had known Rourke was in danger and where he was going, she stopped. They might not have been able to act directly, but they could have sent 11 words. The room was quiet. I'm going to give this to Webb, Emily said, picking up the printed communication. Of course, Patel said. Emily started toward the door. She stopped with her hand on the frame and turned back. There were things she could have said to Raymond Holt. Several of them were true, and some of them were things he needed to hear, and she had the vocabulary for them and the specific tiredness to deliver them without heat. She said none of them. The potassium order, she said instead. The cardiac patient in February. You didn't change it after I flagged it. He looked at her. He had the arrhythmia 4 hours later. You know that. Yes, Holt said. That's the one that bothers me, she said. Not yesterday. February. She paused. The patient recovered, but that one still bothers me. Holt held her gaze. Something in his face moved through several things before settling. It should bother me too, he said. It does. She nodded. She left. Webb was in the ICU corridor when she found him. She handed him the printed communication without preamble, and she watched his face as he read it. He read it twice, which was how she knew it had landed. 6 days ago, he said. Yes. The routing's been stripped. Yes. He looked up. I have 3 candidates for who could have sent this. People with the access and the motive and the technical knowledge to do it this way. He folded the paper carefully. I'll know which one within 48 hours. Does it change anything operationally? No, Prescott is in custody. Greer is cooperating. The contractor network is being dismantled. He looked at her. But it closes a loop I didn't know was open. Someone inside the apparatus tried to protect Rourke and protect you both, without the resources to do it directly. That matters for the broader investigation. He paused. It also means you were chosen deliberately. Not random assignment, not coincidence. Someone who knew what you could do made sure you were in position to do it. She absorbed this. She had understood it from the moment Patel read the message, but hearing it stated plainly was its own thing. I spent 3 years trying to disappear, she said. I know. And someone spent 6 days trying to make sure I didn't. Yes. She looked at the ICU door. Is Rourke awake? He was, 20 minutes ago. He's heading to pre-op at noon. I want to see him before they take him. I was awake. I was also attempting to sit up more than was advisable, which she corrected without commentary by adjusting the head of the bed to a reasonable angle while he watched her with the look of a man deciding whether to complain about it. He didn't complain. Webb told me they got Prescott, he said. Yes. Greer's talking. Yes. He looked at the window. The Phoenix morning was full and bright now, the sky that specific hard blue that the desert made. He looked like a man sitting inside a feeling he hadn't had in several weeks and was taking a moment to recognize it. It's not going to feel the way I thought it would, he said. No, she said. Rarely does. Terry's still dead. Yes. He turned back to her. There were no easy things to say to that, and she didn't try to say any of them. She had sat with the same fact for 3 years, and she knew the shape of it, the way it didn't diminish exactly, but the way you slowly built enough around it that it was no longer the only thing. Aaron called, Rourke said. Terry's brother, about an hour ago. She had not known this was coming, and she felt it arrive in her chest. What did he say? She said, carefully. He said he'd been told. Rourke's voice was even, controlled in the way of someone who had been managing emotion all morning. About what happened, about the compromise, about what you did that day. He paused. He wanted me to tell you. He stopped, tried again. He said Terry used to write home about the medic on the support element. Apparently he wrote about it more than once. He said the medic was the only person out there who looked at them like they were actual people and not just assets. Emily looked at the monitor, not because it needed checking, because she needed somewhere to look. He was a good kid, she said. Yeah, Rourke said. He was. They sat in that for a moment. Aaron wants to meet you, Rourke said, when this is done. When the investigation is public and there's a record. He wants to meet the person who was with his brother. Okay, she said. He said he's not looking for closure. Rourke looked at her steadily. I think his exact words were that closure is something people invented so they wouldn't have to keep feeling things. He just wants to know someone remembers. I remember, she said. I told him that. The room was quiet. Somewhere down the hall, a monitor alarm sounded and was silenced within seconds. The ordinary sounds of a place doing its work. The message, Emily said. The one someone sent 6 days ago, telling them to bring you to me. Webb's going to track the sender. Rourke looked at her. Something in his expression said this was not entirely new information to him. You have a guess, she said. I have a guess, he said. I'm not going to say the name in an ICU room with an open door and 2 federal agents in the corridor, but yes. Someone who knew about the Haverfield redaction. Someone who's been watching Prescott's network for a long time and didn't have enough to move against him officially. Someone who knew about you, about what you'd been before Harbor Ridge, and decided that the best play with limited options was to make sure you were in the right place. She looked at him. That's a significant amount of trust to put in 11 words. Yes, he said. But they knew what you'd do with them. He paused. Whether you got the words or not. Pre-op came for him at 11:50 a.m. 2 nurses she recognized from the surgical floor, a transport aide, the anesthesiologist who had stopped in earlier to review his chart. The organized, efficient choreography of a hospital preparing to take someone apart carefully and put them back together better. Emily stood at the door of his room while they disconnected his monitoring for transport and transferred him to the gurney. He looked smaller horizontally than he'd seemed when he was trying to push himself upright, which was how people in hospital beds always looked, and which she had learned not to read as diminishment. As they wheeled him past her, he turned his head. Carter, he said. You're going to be fine, she said. The repair is solid. Voss reviewed the imaging. That's not what I was going to say. She waited. Thank you, he said. For February. For the potassium order and the chest x-ray and everything else you saw that you weren't supposed to see. For all of it before I ever got here. He held her gaze. Someone like you doesn't disappear. I don't care how hard you try. The transport team moved him through the door and down the corridor, and she watched him go. And she stood in the doorway of the empty room for a moment after he'd turned the corner and felt the full weight of the last 30 hours settle through her in a way she'd been holding at a distance. She was very tired. She was also, in a way she hadn't expected, not willing to go home yet. The press story broke at 2 p.m. Not because anyone at Harbor Ridge released it, and not because the federal investigation had gone public. It hadn't, not officially, not yet. It broke because someone at a local Phoenix affiliate had a contact in the VA system who had mentioned federal agents at a major medical center, and from that seed the story grew with the particular speed of something that was true and therefore inevitable. By 3 p.m., the story had a shape: a decorated military operative, a compromised intelligence officer, a federal arrest in Virginia, a hospital in Phoenix that had been the site of 2 separate attempts on the operative's life. By 4 p.m., Emily's name was in it, attributed to sources she would never identify, described as a nurse with a military medical background who had intervened multiple times to save the operative's life and flagged the threat that had twice been sent to end it. She was in the staff break room when Victor showed her the story on his phone. She read it twice, the way she'd read the 11-word message, and then she handed the phone back. "How do you feel about that?" Victor asked. "Like I need more coffee," she said. "That's not an answer." "It's the answer I have right now." He poured her coffee. He sat down across from her. The break room had the mid-afternoon quality of a brief quiet in the rhythm of the shift. One nurse eating lunch, an aide scrolling her phone in the corner, the low, ambient sound of the hospital breathing around them. "There are reporters in the lobby," Victor said. "I know, Taft's people are managing it." "Are you going to talk to them?" She wrapped her hands around the mug. The warmth of it was still the realest thing, after everything. "Not today." He nodded. Then, "Patel is reinstating you. Effective as of this morning, technically. She's backdating the administrative leave termination to reflect that it should not have been issued." Emily looked at him. "She told me to tell you because she thought you might not pick up her calls today," he said. "She's not wrong about that, is she?" "No," Emily said, "she's not." She also said, and I'm quoting here because she made me repeat it back to her, that the formal review process has been closed without findings, that the documentation of both incidents on September 14th has been amended to reflect clinical decision-making consistent with exceptional practice standards, and that she would like to meet with you at your convenience to discuss a new role she has in mind. Victor looked at her steadily. She used the words trauma response advisory. She also used the words protocol development. She said you'd know what those meant. Emily thought about Sandra Voss saying the current protocols are outdated in 3 specific places and her own instant response. 3 specific places, exactly. "I know what they mean," she said. "Good." Victor leaned back in his chair. "Then can I also say, and this is from me, not from Patel, that this floor has been a better place when you're on it, even when you were making everyone uncomfortable. Especially then, maybe." He looked at his coffee. "The uncomfortable ones are usually the ones paying attention." She looked at him. Victor Gaines had been decent to her consistently, even when it cost him something, even when the easier thing would have been to keep his head down, and she had not said enough about that. "Victor," she said. "Don't make it weird," he said. "I wasn't going to. You had the face." "I don't have a face." "You have a face," he said, and the corner of his mouth moved, and it was the most normal moment she'd had in 30-plus hours, and she felt it land all the way through her set. At 5 p.m., Webb called. "Surgery went well," he said. "Voss says the repair is clean. He's in recovery, stable." "Good," she said. "He's asking for bad coffee and a football game, which the attending says is a positive neurological indicator." "It's a reasonable indicator," she said. "Emily." A pause. "The source of the 11-word message. We identified them." She went still. "It was a retired intelligence officer named Lawrence Okafor. He was the original analyst who built the case file on Prescott's contractor network 2 years ago. He brought it to his chain of command and was told it was unsubstantiated. He was pushed into early retirement 6 months later." Webb's voice was careful. He'd been watching what he could watch from outside the system. When he saw the operational indicators that told him Rourke was the next target and where Rourke was going, he used a contact inside VA administrative networks to locate you. Your service record, the redacted version, was enough to tell him who you were and what you could do. He sent the message knowing it might not reach you. He sent it anyway. Is he... She stopped. Is he in trouble? No, quite the opposite. He's been asked to provide testimony in the Prescott prosecution. His original case file, which he kept, technically outside of any official system, which was inadvisable but turns out to have been fortunate, is now part of the federal evidentiary record. Webb paused. He asked about you. What did he ask? Whether you were all right. Whether the nurse he'd tried to warn was all right. She stood at the window of the small borrowed office, looking at the parking structure, the late afternoon sun turning the concrete orange and gold in a way that made it look almost like something other than a parking structure. Tell him yes, she said. Tell him the nurse is all right. 3 weeks later, on a Tuesday morning in early October, when the Phoenix heat had finally decided to become autumn, Emily Carter walked into Harbor Ridge Medical Center through the main entrance. Not the staff entrance. The main entrance, through the glass doors, past the information desk where Tomas was on his shift and gave her a nod that meant he'd heard the story and had decided how he felt about it, which was apparently positive. She had a meeting with Patel at 9. She had a meeting with Voss at 10:30, which would almost certainly run long because they'd been emailing about the trauma protocol revision for 2 weeks and had already identified 11 points of specific disagreement that were going to require an actual room and an actual whiteboard to work through properly. And at noon, she had agreed to be present in the conference room where a delegation from General Whitmore's office was going to formally present the corrected service record commendation to her in person. She had not wanted a ceremony. She had said so explicitly to Webb, who had relayed it to Whitmore, who had reduced what he'd originally planned to 15 minutes and 4 people instead of something larger. She had accepted 15 minutes and 4 people. She had also accepted, the previous week, a call from Aaron Bosch. He had been quiet at the beginning of the call. She had been quiet too because there was no script for this and she was not going to pretend there was. Eventually he had said that he'd read the amended after-action report, a redacted version that he'd been authorized to access, and that he understood now what the last 3 years of not knowing had felt like, having the full shape of it. I'm not angry at you, he'd said. You don't have to say that, she'd said. I know I don't, he'd said. I'm saying it because it's true. Terry didn't survive. That's not something anyone can fix. But the reason he didn't survive isn't what I thought it was for 3 years, and that matters. That actually matters. A pause. He wrote home about you. Did Rourke tell you that? He told me. He said you were the only one who looked at them like they were people. Aaron's voice had been steady, careful. I just wanted to say, on his behalf, since he can't, thank you for seeing him. She had not cried during that call. She had cried after, briefly, in her car in the parking lot of the grocery store where she'd stopped on her way home, and she had allowed herself that, and then she had driven home. That was how it worked. Not clean, not resolved into something without weight, just carried differently. Rourke had been discharged 8 days after surgery. He'd sent her a text. Out. Moving to the rehab facility in Scottsdale. They have decent coffee, which is more than I can say for Harbor Ridge. She had texted back, drink the coffee, do the physical therapy. Don't be a difficult patient. He had replied with a single thumbs up that communicated both agreement and an intention to be exactly as difficult as he decided was warranted. She had smiled at that. The federal indictment of Colonel Daniel Prescott had been filed on September 26th, 12 days after everything. The charges were substantial: conspiracy, unauthorized disclosure of classified information, 2 counts of conspiracy to commit murder for the attempts on Rourke's life, and a 3rd count being reviewed in connection with the original Haverfield Compromise. His lawyers had issued a statement. The statement had not contained anything that changed the substance of the evidentiary record. Foster Greer had accepted a plea agreement. The terms were not public, but the cooperation was documented in the filing, which meant his information had value that the government intended to use. 2 additional members of Prescott's domestic network had been arrested in the weeks following. The contractor company had been placed under federal review and its DoD contract suspended pending investigation. Dr. Holt had submitted a voluntary request for a performance review by the hospital's medical staff committee, not in response to any external pressure, as far as Emily could tell, but of his own decision. She did not know what the outcome of that review would be. She had not been asked to participate in it. She suspected Patel would tell her, in time, and she found that she was able to wait for that information, which was its own kind of progress. She was not a saint about Holt. She did not have uncomplicated warm feelings about a man who had told her, in a corridor, that she didn't know the difference between a hospital and a battlefield. What she had was something more functional, an understanding that people operated from the information they had, and that institutions shaped what information people thought they were allowed to have, and that the same structures that had let Holt dismiss her had also made it easy for someone to use him without his knowing. That understanding was not forgiveness. It was just accuracy. She had learned slowly that accuracy was often more useful than the feeling she'd expected to have. Now she walked down the main corridor of Harbor Ridge Medical Center and past the ER entrance, and through the glass she could see the bay where it had started, where a soldier had arrived with his chest torn open and she had said tracheal deviation, right side in a voice that had cost her something and saved everything. She stopped for a moment and looked at the bay. It was occupied by someone else entirely. A woman with a wrist injury, it looked like. An intake nurse she recognized doing the assessment. Ordinary. The absolutely ordinary business of an emergency room on a Tuesday in October. She looked at it for another moment. Then she kept walking. She had work to do. Not the dramatic kind. Not the kind that arrived in crises and required everything she had at 3 a.m. and made her run up stairwells with her heart at the base of her throat. The slow kind. The kind that was about building something that lasted past the emergency. Protocols that meant the next patient didn't depend on the right person happening to be in the right room. Training that meant the next nurse who saw something real would have the language and the structure and the institutional backing to say so without being told to stay in their lane. That kind of work was not glamorous. It didn't resolve in a single day. It didn't come with federal agents and general officers and the particular clarity of a crisis that demanded everything you had. It was harder than that, in its way. She had learned something in the last 3 years of trying to be quiet, and in the 30 hours that had ended that quiet so thoroughly. She had learned that the choice between staying small and taking up space was never as simple as it seemed when you were in the middle of making it. She had stayed small because staying small felt like protection, from the weight of visibility, from the cost of being seen and possibly found wanting, from the particular grief of trying hard and having it matter and then losing something anyway. But staying small had not protected her. It had only meant that when the moment came that required everything she was, she'd had to find it in a rush, under pressure, in a trauma bay with the clock running. She had found it. She would always find it. That was not arrogance. It was just something she now understood about herself, the way you understood structural facts about a building you'd lived in long enough. The question was not whether she had it. The question was whether she was willing to not hide it. She was done hiding it. She went to the elevator and pressed 4. The morning was just starting, the hospital breathing around her in all its ordinary and extraordinary business, and somewhere in the surgical recovery wing. Devin Rourke was drinking mediocre coffee and being mildly difficult. And somewhere in Virginia, a federal case was being built line by line. And somewhere a retired analyst named Lawrence Okafor was preparing testimony about what he'd known and what he'd done with 11 words when official channels had failed him. She thought about those 11 words as the elevator climbed. They're sending Rourke to you. You're the only one who can keep him alive. The person who had sent them had trusted her without knowing for certain that she deserved the trust. They had read a redacted record and seen through it to what the redaction was trying to conceal. And they had decided that what she was, what she had always been, was not something that could be permanently buried. Not by paperwork, not by the preferences of institutions, not by her own 3-year effort to become someone less. She thought the person had been right. Not because she was extraordinary. She had made mistakes in that operating environment, and she had lost Terry Bosch, and she had spent 3 years with both of those facts in the same place in her chest, not canceling each other out, just coexisting. She was not extraordinary. She was a nurse with a military background and a set of skills she'd earned by being in difficult places and paying attention, and a habit of seeing things that other people walked past that had made her professionally inconvenient, and apparently, when it mattered most, exactly what was needed. That was enough. It was, she had decided, more than enough. The elevator opened on the 4th floor. She straightened the strap of her bag, walked out into the